long-term relief and the key exercise tip for sorry achieving long-term relief and the key exercise tip after steroid injections for neck, back, and nerve pain relief. So if you are one of those mums, busy mums who are juggling their work and their demands of family life or kids while you're battling with chronic neck, back, or nerve pain, you understand the importance of achieving effective pain relief. And you might have explored the option of steroid injections, and steroid injections do offer relief from relentless pain and discomfort yet you might have been feeling during work, during your office hours, that is, or you're at home with your children, etc. Now, however, there is one essential exercise tip that needs to be followed after getting your steroid injection so that you can get the maximum benefit of this injection. Now, in this video, let's discuss what is that one essential exercise tip that you should follow, and how you can implement it. Rather, how can you prepare for it even before you get the injection? Now, before we get into the topic for today, for those of you who don't know me, my name is Swati. I'm an executive mom power coach. I help moms of younger kids who work in high stress executive jobs to manage their spinal, that is, back and neck, and nerve pain. Now, I do all of this by giving you simple exercises, easy lifestyle modifications, and some tips, tricks, and hacks that have worked for me in my own pain journey. And I do all of this without taking away a big chunk of your time because, hey, we're moms, we're busy people, right? So let's get back into the topic for today, that is achieving long term relief, the key exercise tip after steroid injections for neck, back, and nerve pain. Now, if you did not watch my video 2 days ago, that was my latest video. We did address steroid injections and a generalized overview about steroid injections for back and nerve pain relief. Well, the same is applicable for neck pain as well. If you missed that video and you'd like to have more details, you can go to my YouTube channel and look for it there. Or if you're watching me on any other platform, if you scroll back, the video should be there. You can go to YouTube, type my name, Swati Prakash, steroid injection or back pain, nerve pain. It will come up for you. All right. So when usually a doctor will recommend you a steroid injection when you have back pain, nerve pain, or neck pain due to, say, sciatica or a disc issue or stenosis, degeneration, arthritis. I mean, there can be n number of issues due to which a doctor would recommend you a steroid injection. However, there is a lot of negative associations with steroid injections. To cover it very briefly, because I did address it in the other video, one is that repeated steroid injections can lead to weakening of the tendon, that is the attachment of the muscle on the bone. However, be mindful that doctors usually will not give you more than two or maximum three or four injections in a year. So there are less chances of this happening unless, of course, you're going for repeated injection year after year. I mean, during that maximum three or four injections year after year after year. But then doctors are quite wary about this side effect, and they will advise you against it. So, of course, this is a call between you. I mean, this is a discussion that needs to be done between you and your doctor, and this is a call that your doctor will take. However, in terms of rehab and exercises, let's come to that one essential tip that I want to share with you. When you get a steroid injection, of course, you need to rest for the first 24 to 48 hours. Your doctor will advise you on that. However, after that first 1 or 2 days of when your joint settles in, or after the injection, you should gradually, not all of a sudden, but gradually and slowly get back into your rehab protocol. What I mean in simple English is start with your exercises, because with steroid injection, most of the people get like a magical relief of their pain, especially if you've been suffering from acute pain that is not letting you do much. And because you are in a pain free period after enduring all that pain and discomfort, we tend to sort of forget about the pain and go do all the activities that we wanted to do. By all means, do that, but make sure that you're loading your joints and spine slowly and gradually. So, whatever is causing your problem is still there. Yes, the steroids go in and reduce the inflammation. That's how they work. But it's not that your herniated disc has suddenly gone back into its normal position. It has, of course, got less swelling, less pain, less redness, etc. That is, signs of inflammation have reduced. But you still need to be a little cautious about loading your joints slowly and gradually. Also, this is your golden time for getting back into your exercises. So even before you get the injection, go to your doctor. If you don't have a physical therapist, get a referral for one. Ask your doctor, ask your friends, neighbors, nearby clinics. You can go by word of mouth or trust what your doctor's telling you, and then go to a physical therapist and tell them, I'm going to get an injection, get an assessment done, and ask them, what do you recommend for my rehab? Can you make like a rehab protocol for me, or give me an outline of what kind of exercises I should slowly and gradually get into after I get my injection, so that once the injection effects wear off? I mean, why are we discussing all of this is because once the effect of the injection wears off, which will happen in a few months' time, uh, you have got stronger muscles, less muscular imbalances. That is, you've stretched out the tight muscles, you've strengthened the weak muscles. You have a lot more control over that area in terms of your muscles, ligaments, etc. So that when the pain comes back after the injection effects have worn out, you are better prepared for that pain, because injections don't last forever, sad as it is, but that is the truth of the matter. So you have to be prepared for when the pain comes back. So the whole purpose of getting an injection is, of course, pain relief, but also to get that pain free period so that you're able to strengthen the area. For example, if it's your back, I would go for strengthening the back muscles. This is, of course, very generalized, your therapist will tell you better, but to strengthen your back muscles, to strengthen your core muscles that support your spine, that is your lumbar spine, to sort out any muscular imbalances in the area. If there is a nerve being pinched or irritated, to do the stretches for your nerve, to do the nerve flosses, that is basically like a kind of stretch for the nerve, to build up the strength in that area, basically. So that when the effects, as I said before, I'm repeating myself, when the effects of the injection wear out, then you are better prepared with a stronger back to go in and face that pain. So, well, that was it that I wanted to talk to you about. If you have any questions, any comments on this video, do leave them below in the comments and I will address them for you. If, you're getting an injection or not, that is a decision between you and your doctor, of course. This video is not intended to replace medical advice, so go with what your doctor's telling you. This is just a pro tip for after you get your injection. If you are getting an injection, think about what is the problem with your back, neck, or nerves. Basically, inflammation is the cause for most of these pains. And if you want to control your inflammation so that you cut off the cause at the root, at the base of what's happening with your neck, back, or your nerves, I have left a link in a blog that I have written on the same topic. I will leave the blog link in the description of the video. If you can't find it on Instagram, it will be in my bio in the Instagram. If you can't find it, just message me and I will send the blog link to you. In that blog, I have left a link for the protocol that I followed to reduce my inflammation. It is a very useful one. There are lots of people who have had a lot of benefit from that protocol. It is a free protocol. You can follow it. It's quite easy. It just goes on for 11 days. And of course, if you want to find out the source of your back pain or your neck pain, or you want to know more about how to manage your nerve pain, I've left some links to some free guides that I have made on the cause of your neck pain, the cause of your back pain, and how to manage your nerve pain as well in that blog. So it's quite useful. And I have also attached some videos that describe joint injection in more details in that blog. So have a look. It's quite useful. And yeah, I'll see you guys next time.